Chapter 7, Interpretation of Medication Labels and Orders. We'll skip past the terms and definitions because we'll cover them in the chapter. So it starts off with a pretest. Says if you're comfortable with the subject matter, you can complete it to your knowledge. I would say it's probably good practice after you went through the lecture video and stuff like that, but if you have no idea what you're doing, it's not going to be super easy to do at the beginning point. So I'm going to skip past that. Prescriptions are medication ordered by prescribers in outpatient settings, and in inpatient settings like hospitals or institutions, medication orders are what we call them. Whatever the setting, it is important for the pharmacy technician to be able to read and interpret these orders accurately. This is why it is important to learn the abbreviations from chapter 1. Every order must be reduced to writing as soon as possible, and the pharmacist must transcribe any verbal orders. Also, a pharmacist is required to handle any clarification of orders with the prescriber. So, depending on the state, I'm going to tell you that in Michigan, I've done both of those things, and the pharmacist usually handed them off to us. The ability to interpret a medication order or prescription is an essential skill for professionals who work with medications. The pharmacist is ultimately responsible for dispensing the medication as ordered. As a pharmacy technician, you have the training to perform most functions in the pharmacy. Because the field of medicine is always changing, staying current with new medications and new indications for older medications, patient safety is the most important aspect of dispensing medications. So for those of you that have been in the pharmacology courses, this will be kind of a little bit of a review. Those of you that have not, this will be kind of an introduction to this information. Knowledge of pharmacy includes pharmacokinetics, the movement of the drugs through the body, and pharmacotherapeutics, the therapeutic uses and effects of drugs, whether beneficial or harmful. The field of toxicology includes the study of the adverse effects of chemical substances on the human body. It is important to learn the normal dosage range for medications so that you can check your calculations to see if your answers would make sense. It is easier to check your answers for accuracy when you have an idea of what doses should be. The difference between the therapeutic dose, the desired, and the toxic, harmful levels of medications must be considered, as well as possible drug-drug interactions, drug-food interactions, and drug-disease state interactions. A prescription is a means for a physician or other health professional to provide the information needed by the pharmacist to dispense the desired medication for a patient in an outpatient setting. It is an order written for a specific person by a medical professional licensed to prescribe for a specific condition. The rules about who may prescribe vary from state to state, so the statutes of the state of practice determine the legalities of prescription writing. As a legal document, the prescription indicates the medication desired and the directions for use. Figure 7.1 shows us the components of a prescription, and this is a pretty helpful little chart here. So we have superscription, which means it's the RX symbol. That's always going to be on prescriptions. It means take this drug. An inscription is the medication name, dosage form, strength, and metric quantity. Subscription is the instructions for the pharmacist on how to compound if needed. The SIG is the directions for the patient and how much, when, and how long to take and how. Down here we have the substitution permitted or DAW, the number of refills, and the prescriber's signature. Up here we have the prescriber's office address and telephone number and the date written. Legally, the physician's DEA number must be on a prescription if it is written for a controlled substance. As you work through prescriptions, an understood meaning is that if a tablet or capsule is ordered, the route of administration is by mouth, which is PO, unless otherwise indicated. When typing prescription labels for the public, make sure that the instructions are clear and easy to understand. I always say that you should proofread your directions before sending them to the pharmacist to verify. Begin oral prescriptions with take and always state the number of tablets, capsules, or milliliters as opposed to the strength. For example, if the prescription is for 500 milligrams and the medication comes in 250 milligram tablets, we would put take 2 tablets, not take 500 milligrams. Other direction words used include instill for eye or ear medication, insert for suppositories, apply for topical preparations and patches, inhale for nasal and oral inhalers. A few medications, including insulin preparations, are prescribed for subcutaneous use, in which case you would use inject subcutaneously or inject under the skin. The Institute for Safe Medication Practice recommends the use of numeric rather than alphabetic characters on prescription labels. Therefore, in this text, use numbers such as 1, 2, and 3 on prescription labels as opposed to 1, 2, and 3. In its quest to reduce medication errors, the ISMP also recommends the use of numbers over ambiguous terms such as twice daily. This should be written take 2 times a day. If a prescription is written for the brand name and substituted with the generic, you must put generic for whatever brand name with the specific brand name entered on the label. As seen in figure 7.1 and 7.2, a prescription must include the prescriber's address and phone number and the date it was written. Whereas a prescription label includes the pharmacy name, address, and phone number and the date it was filled. These concepts are in bold to emphasize the difference. The prescription interpretation is how one would read the prescription without the use of abbreviations. The label directions are written for the patient in language that is easily understood. So looking at this prescription here, we have SIG, and then it says I. So that I just means 1. So 1 tab POQAM. So for that, if we were writing directions to a patient, we'd always say take, and then 1. Tab is tablet. By mouth is PO, so by mouth. And then QAM means every morning. Take 1 tablet by mouth every morning. This prescription is written for Mycostan oral suspension. It says, so these are the SIG, right? This is the SIG right here. And for the directions, we would say shake medication and then swish and swallow 5 ml every 4 to 6 hours. So practice problems A, if you want to go through those, they're good practice. A medication order is a method of providing the same information as is found on an outpatient prescription, but it is used in an inpatient environment. Whereas a prescription is written for either the number of doses or length of time of therapy, a medication order tells a healthcare professional what drug or drugs should be administered, how to administer them, the strength of the medication, and the frequency with which they should be given in an outpatient setting. The medication order contains the date, patient name, medication name, dose, route of administration, time, and frequency of administration, and the signature of the prescribing professional. Although only recommended in emergency situations, they can be verbally communicated. However, for legal purposes, each order should be transcribed into writing by the healthcare professional who accepts the order, and the order must be countersigned by the healthcare professional who communicates the order and is licensed to prescribe medications in the state of practice. Even though in most inpatient pharmacies, a pharmacist enters medication orders into the computer, the pharmacy technician still has a responsibility to check as he or she is filling orders and report any concerns to the pharmacist. When interpreting medication orders, simply restate the order without the use of abbreviations. Include the name of the drug ordered and strength, because these are orders that will only be seen by other healthcare professionals, not patients. So that's the difference between prescriptions and med orders. So an example, discontinue naproxen 375 milligrams, start naproxen 500 milligrams, POBID, you would write it as discontinued, naproxen 375 milligrams, start naproxen 500 milligrams by mouth twice daily. Practice problems B, you can do for your own practice. Interpreting stock medication labels. The label on the stock medication bottle identifies the drug within the container. It also indicates the important information needed in bold to dispense the drug as follows. So the generic name, which is the official name that is assigned to a medication after approval by the FDA. The trade and brand name, the name assigned by the manufacturer. The National Drug Code, the NDC, a 10-digit 3-segment number that identifies the manufacturer, the labeler, the product, and the size of the container in which the medication is packaged, a universal product identifier in the United States. The dosage strength, the amount of active ingredient found in the medication, such as micrograms, milligrams, grams, grains, units, or milliequivalents per dosage form. The total quantity of medication, the amount in the container is packed by the manufacturer. Dosage form, name of the manufacturer, special instructions for mixing or compounding if indicated by the manufacturer, storage requirements of the medication, lot and batch numbers or control number of the medication that can be used for identification if the medication is recalled, expiration date, controlled substance indicator as appropriate, indicated by a large C with the schedule number and Roman numerals within the C. The generic name should be expressed with a lowercase letter such as diazepam, so the lower D. The brand name is expressed with a capital letter such as Valium. If the medication is the generic form of the drug, a trade name will not be found on the manufacturer's label. One of the most important aspects of patient safety is the careful interpretation of the medication label. To ensure that the proper medication has been provided for dispensing, the label should be read when taking the medication from the shelf, before preparing the medication for dispensing, and when returning the medication counter to the shelf for storage. By reading medication labels carefully, you can reduce errors and avoid confusion, and the therapeutic potential of the drug is maximized. The pharmacy technician must be fully aware of the information on the label, including the expiration date, to ensure that the medication dispensed is the highest quality and exactly as ordered. So they always say that you should check and read medication labels at least 3 times. And practice problem. We'll do a few problems from A, B, and C. Just a second. It is absolutely necessary that you interpret medication orders and prescriptions correctly. There must be checks and balances among the prescriber, the pharmacist, and the person responsible for obtaining the medications for dispensing, such as the pharmacy technician, as well as the person administering the medication. Any break in the checking process could result in the patient getting the wrong medication or strength, which could have dire consequences. All right, now we'll go over some of each kind of problem. Okay, so we're gonna do some examples from chapter 7. So we have the SIG 1 tab by mouth daily. The C means with, but this is a prescription, so we're writing this for the patient. So we want to have that verb, so we're gonna say take 1 tablet, so we would never leave tab. PO means by mouth. Daily. Excuse my handwriting. With morning meal. The next one, same thing. We have 1 tab PO daily. So take 1 tablet by mouth daily. So we have our verb, we have our quantity, we have our dosage form, we have our route of administration, and we have our amount of times they're gonna take it per day. All right. The next set of problems that we're gonna go over, these are med orders. So these are written for medical professionals, not for patients. So we would do like, so for number one, we would say discontinue Zocor. Add Lipitor, 10 milligrams. 1 tablet by mouth at bedtime. And then number two, we, unless it says like discontinue, we're always gonna state the name of the medication name first in med orders. So amoxicillin suspension, 250 milligrams. PO is by mouth. TID is 3 times daily until discontinued. And I think the book will say, has you writing numbers instead of spelling them out like here, so probably should say 3. With the number 3 not spelled out. And then the third problem here, we have cephalexin, 500 milligrams by mouth every 8 hours for 3 days. And the last type of problem for this chapter. So we have a drug label here. Who is the manufacturer of this medication? And that's going to be right here, Pfizer. What is the NDC number? So 0, 0, 0, 9, 5, 0, 1, 3, 0, 1. What is the trade name? So that's the brand name. So on a brand name medication bottle, it's going to be capitalized. So it's Glycet. What is the generic name? That's going to be the lowercase in the parentheses. So Miglatol. What is the strength of this medication? 50 milligrams. And how many tablets are in an unopened container? So 100.